Objective 7, perhaps we should start at the bottom. In a recent study of dry eye, 86% of patients evaluated had evaporative dry eye, MGD, by Dr. Lemp, who is the guru of dry eye. What's important to understand is that the majority of all dry eye signs and diagnoses that you make, the majority of all dry eye symptoms, the majority of all dry eye associated with contact lenses are due to evaporative dry eye, which in turn is due to MGD. One of the most valuable tests you can do is to determine whether, if you solve the evaporative dry eye problem, whether the patient will have success. So you put the individual, have them just wear a common pair of swim goggles, prime the inside of it on the rim with a little bit of moisture to raise the moisture, have them do a baseline for 5 or 10 minutes as to how their eyes feel on a scale that we've perfected. Every 5 minutes they record how their eyes feel for 30 minutes, and then you take the goggles off and you see what happens. If they, on a grammar school grade, A, B, C, D, F for your mark, if they enter it with a C and they go to an A within 15, 20 minutes, they have evaporative dry eye, and if you can make that lipid layer thicker, you will resolve the problem. So that's a test that we frequently do whenever we have any doubt, or we want to convince the patient, or we want to show to them what their problem is. It also rules out neuropathic pain. And as I mentioned, I think to several of you speaking earlier today, I'm really interested in the effects of humidity, how they influence neuropathic pain, and that's a major thrust of our present research. And we originally published back in the 70s and 80s, but in 2012, I think we have one in press now on the effects of high humidity on pain.